Hey guys, so my discussion post today is on COPD. So before we get started, we'll take a look at what a set of normal healthy lungs looks like. So we have our patient here who is a non-smoker, which is definitely key when discussing COPD. So we have here the patient whose trachea comes down into their bronchi on either side here. Those bronchi then branch off into bronchioles. I'm not a good artist, I'm sorry guys. And then at the end of those bronchioles here, like I drew over here, we have what's called the alveoli. The alveoli are probably one of the most important structures in the lungs, in my opinion, because they're responsible for the proper exchange of oxygen and carbon dioxide. So if we can't properly exchange oxygen and carbon dioxide, we're definitely going to have some problems. So these small little air sacs, some people call them grape-like clusters, they're easily inflated, and they're made of an elasticy substance. They're bunched together pretty close like that. They really do look like a cluster of grapes. So this is great. So what happens in COPD? So COPD is also called chronic obstructive pulmonary disease. It can be chronic bronchitis, our patients who have emphysema as well. So what happens is we have our patient here who has their trachea and their bronchi and their bronchioles in the alveoli as well. That's great. But what happens with them is their airways start to become dislodged with mucus. They start to have trouble clearing that mucus. They're also having trouble exchanging oxygen and carbon dioxide properly because of what's happening again in the alveoli. So patients who have COPD, most of them have grape-like clusters. They're air sacs that look like this. The walls lose their elasticity. They're not properly exchanging the oxygen, carbon dioxide, and a lot of times many of them are destroyed. Most people tend to say COPD and smoking go hand in hand, which is true, but a lot of people actually don't need to be smokers to develop this disease. Maybe they worked in conditions that were unfit, such as, in factories without proper ventilation, working with different chemicals, pesticides, things like that really do cause damage to the lungs over time. So what do us as nurses do for our patients with COPD? Well, first and foremost, we're going to educate our patients, teach them the importance of smoking cessation, and if they're not smokers, definitely keep working on prevention, especially as patients start to go into their teen years. There's going to be a lot of peer pressure to start smoking, so we really want to enforce with them that they are not smoking. We're going to monitor their O2 saturations. People who have chronic obstructive pulmonary disease definitely have a lower O2 sat because they're not exchanging the oxygen. The hemoglobin in the blood cells, red blood cells, is unable to bind properly, so we're not getting that good exchange. We're going to observe for clubbing, which is like a swelling and flattening of the fingers. This is a wicked common sign of people who have COPD. Monitor for them for chest pain, tightness, wheezing, things of those types of nature. We're going to look for cyanosis, which is a ballooning of their lips and fingernails, again due to lack of oxygenation, and just make sure that they're not having any worsening of symptoms. We don't want to have them go into respiratory distress if there's something that we can do to prevent that. Again, with prevention, let's prevent the exacerbation of symptoms for the patient. You don't want to wear heavy smelling lotions or perfumes. Aerosol sprays, things like that can be detrimental to your COPD patient. It really does give them a more difficult time breathing than they're already having. If you're doing activities with your patients, make sure you allow them adequate time to rest. Something so simple as getting out of bed for these patients can really cause them a lot of trouble. It can be exhausting. Monitor them for depression. A lot of patients tend to isolate themselves. They're not able to properly interact with people. They feel like they're holding people back. They're unable to keep up. Lastly, when it comes to your assessment, the doctor may order for PFTs, which are pulmonary function tests, or spirometry to be done. Mental status is huge as well. Again, we're not having the proper oxygenation through the lungs. We're not getting the proper oxygenation to the brain, which can cause an altered mental status. And then we're going to monitor for tachycardia as well.